everyone. Welcome to the Preemies Chat, and thank you so much for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, or CPBF. We are a charitable organization, and our mission is to empower families of premature babies through support and education. This Preemies Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and parents who share with us their knowledge and experience. Also on our website, canadianpreemies.org, parents will find all kinds of resources and support. And today we're going to talk about Preemies and all things physiotherapy. Lexy and Brianna's talk will focus on physiotherapy roles in premature babies and information regarding motor milestones and development. They will touch on assessment, treatment, general monitoring, and tips and tricks for various age groups. And we have here joining us live from Vancouver, Brianna and Lexy. Brianna Fong is a pediatric physiotherapist based out of Vancouver, providing one-on-one care for her patients. Throughout her private physiotherapy role, she sees a wide variety of ages for various reasons, but loves working with newborns and their families to provide education and support to support them throughout development. In addition to provide infant assessments to address motor skill delays, positional head shape concerns, and motor development support, Brianna also has training in assessing and treating babies with feeding difficulties. Brianna, thank you so much for joining us here.
Thanks, Fabiana.
And we also have Lexy, who is a Vancouver Island native who now works and lives in Vancouver. Although Lexy loves many aspects of pediatric physical therapy, her favorite things are finding creative ways to get children to their maximum physical potential, educating parents and families on the role of physiotherapy, and supporting their concerns, and helping children progress and accomplish whatever goals they and their families might have. Lexy has worked with many premature babies to guide them through motor development, to discuss equipment and positioning, as well as addressing concerns from parents and families. Lexy, thank you so much for being here with us today. This is a lot of things to cover in a very short period of time, and I know you have a presentation to share with us. And to all of you watching us live today, please do send your questions, your concerns. Obviously, you're not going to be an online assessment, but I think there are a lot of questions that parents have that you can cover today. So the floor is yours, and then I see you shortly.
Said, we're so happy that you guys have us here today, so thank you so much. So we'll be talking prematurity and all things physiotherapy for you guys in the Canadian Premature Babies Foundation. So I'll click the next slide here. So who are we? So we already had our little introduction, so thank you so much. So I'm Lexy, and then this is Brianna or Bree. We're both physiotherapists, and then I am the clinical manager at my location, and then the community engagement manager is Bree's position. Also, we work together at the Canby location in Vancouver, so we'll talk more about that later.
Awesome. So one of the things that we often get questions about when we say that we work with kids, a lot of families and parents are like, okay, well, like, why do kids need physio, or what does a session even look like? So we always like to bring up the slide at the start to kind of give a visual idea of what it could look like, especially if a little one is still kind of learning how to get those rudimentary milestones and how we can help.
So just going through the agenda today, so we kind of know what to expect with the prematurity and all things physio talk. We are going to discuss the reasons infants and toddlers come to physio, the principles of infant development, tracking motor milestones, and then we'll be going through the milestones by skill as opposed to age today. We're going to talk about how physio can help with motor skills, specifically for our premature babies, and then red and yellow flags to watch out for as your baby's growing.
Awesome. So we're going to start a little bit more about some general principles of why infants and toddlers will typically come to physio. So when it comes to physio for babies and toddlers, there are kind of three main reasons that we will often see little ones. So the first one is torticalcephaly. So essentially that's when torticollis is when a baby prefers to look one way or another, and it often has to do with muscle imbalances in the neck or certain positioning preferences. And then because of that, they do sometimes develop plagiocephaly, which is essentially baby flathead syndrome. And that's really just because their skull is still quite soft. So whenever they have sustained pressure on one side, it kind of flattens that side out. The other group that we typically will see is for developmental delays. So a developmental delay is essentially that a skill is either being attained later than what we would expect, or there's a complete plateau in skills. And it doesn't necessarily have to be a formal delay. It could be something that is suspected or something that the pediatrician or your family doctor is concerned about. And this is especially an area that we want to consider if a baby is premature, because we want to make sure that we're comparing them to their corrected age and not just their chronological age to determine if there is a true delay or if it's just a relative delay to their peers. And then the third group that we often see is healthy babies. So just because a baby doesn't have any, or a family doesn't have any concerns, doesn't mean that they wouldn't benefit from physio. So we often spend a lot of time with education for parents, strategies to help them achieve their next motor skills, and helping support them when they continue to grow and develop. Awesome. So what does physio look like for a little one? So every little one is completely different. So our approach really is tailored to what they need. But this could look like facilitated gross motor skill practice, modified positioning for activities, various stretches, like Lexy and Fabiana mentioned earlier. Some of our physios are trained in doing feeding, tongue-tie, jaw, and neck assessments and treatments. And then there's something called reflux integration, and this is something that we also really want to focus on with preemies. So all babies are born with reflexes, and essentially that means that it's an involuntary response to a stimulus. And they really help with performing those early movements until the time that they're more consciously able to produce a purposeful movement themselves. And then we say that these reflexes integrate, or they become part of that motor pattern. Specifically for premature infants, we want to make sure that these reflexes are integrating at the appropriate time. And if they're not, we want to keep an eye out if they're either absent or persisting outside of what that typical time frame would be. And that's really an indication that their nervous system would be developing appropriately. And then other things that some of our physios use, so there's specialized handling techniques such as CME, and then we also spend a lot of time on education for parents and really supporting that family through the transition of their little one's motor skills.
Awesome. Okay, and then next we're going to go through the overview of infant development. So I'll go through this here. So this is a pretty juicy section as well. So I'm going to briefly touch on some of this stuff, go into a little bit more detail, and then we go through all of these principles as we talk about the motor milestones. So how does a baby develop? So these are kind of the key principles. There's more to it than this. So I'll just touch on a little bit, and then we'll talk about the importance of each one. So head to toe, this means we actually want the baby to develop from head to toe first. So we don't want lower parts of our body strengthening before our head. And this principle we go in very detail with, starting with Bree, about how that works. And then we talk about flexion before extension. This one, again, is a really huge one for premature babies. We go into detail talking about learning flexion first, and that's actually the position we start in the womb. So if you think about a baby, they're kind of tucked up in their little cocoon. Premature babies lose some of that if they're born early, and sometimes if they're born really early, they actually don't get the opportunity to get that flexion or flexor tone, which actually helps progress us to the next motor milestone. We talk a little bit about proximal to distal, so that's just kind of meaning in to out. So we want our core and our inner parts to get stronger before our arms and legs. General to specific, so all our muscles recruit together before individual muscles are able to. 2 before 1, so usually we learn to do things not reciprocally, so we'll learn to use both our arms or both our legs at the same time. And then gaining control. So the more we develop all these things together, we have more control. So if you think about an older kiddo learning how to lower down into a squat, at first they might do a big flop, and then after that, they slowly get that control so that they can actually go down into a squat to play. So I'll dive in for prematurity. We want to focus mostly on head to toe flexion before extension. So I'll just click to the next one so we can relate that to what you guys want to know. So the first thing a baby needs to gain is head control. So you can see this little one working on it right there. So head control is the key to learning the next motor milestones and developing strength in the sequential order. The motor milestones are building blocks for increasing strength and function throughout our body. So basically, we'll touch on it again later, but the head is first, and then we kind of work our way down. So like head, then shoulders, arms, etc. So why is this important and why we want to think about it for preemies? We don't want to put babies in equipment before they're ready. So if we put, for example, a baby in something where they can't hold their head up, then they're flopping side to side, then it's actually not safe, and it doesn't give them the opportunities to develop these skills like tummy time. One thing to note, that tummy time will look very different from when you're first starting it out at day one, where the goal is just to lift the head, and then moving all the way to maybe like 5 months, 6 months past that, and maybe we're working on pushing up on our arms. So keeping in mind this principle as we go through. Feeding is another really good point. So head strength is really important, because when we get older and older, once we have that full head control, the time will vary, but then it becomes more safe to have solids. So if we think about putting a baby in a high chair, this is something to remember as well. So that's why we all the time talk about how important tummy time is, but it continues to be important even as they get older and learn new skills. Great. So flexion before extension. So this one, again, as I mentioned, is really important for premature babies, especially the ones that are born really premature. So even before the 30 weeks, anywhere from the 20 below or even up to the 30 point. So approximately the first month of life is spent in that flexion position. It's actually an important way that we use that flexion to learn new skills. So you can see an example here is just a baby sitting and actually learning how to sit by leaning forward and kind of propping their hands first, and then they'll get more control. For a baby who's even younger, one of the first things that babies learn when they're moving is to bring their hands to midline into that flexion kind of position, and it helps them learn to eventually reach. And it also helps, that flexion before extension helps with sensory regulation and integration as well. So I'll go on to the next slide to talk about it a little bit more, but things to consider with flexion before extension for premature babies is, as I mentioned, what age was your child born? So not necessarily the corrected age, but at what point in weeks did they come into the world? Because that's going to be really important for when that flexor tone was made. So in the womb, between 30 to 32 weeks is when we start the development of the first part of flexor tone. And then when we get closer to the 35, 36 weeks, that's when the second part is initiated. So if you were born before that, you actually won't have flexor tone at all. So it's something that would need to be taught and practiced. We also consider was there any time spent in the NICU? So if you have an extended stay in the hospital after being premature, there's a lot of things to consider with that. So was there noises? Was there tubes? Was there lights? Did a baby have to spend a certain time in a position? So maybe they had to be on their back because of tubes or feeds or anything like that. Were they held in only certain positions for safety purposes? Did they get opportunities to play? All of those kind of things are considered, especially when we're looking later on at sensory things for motivation. There's a ton of stuff to consider and unfold there. And then do they extend or do they have flexion? So as I mentioned, if your baby isn't showing those signs of flexion and they're mostly extending, we'll talk more about that later, but that's something to consider, that they may need to be taught those skills depending when they were born. And then gravity, if they're born and they don't have that flexion, is going to be too big of a force. So if that's something you're noticing, where even if you're practicing these motor milestones and it seems like gravity just pulls them down or they can't lift their head, things like that, maybe they were missing that key piece of their flexor tone or various other things. And then we'll talk about it a lot later when Bree's talking about how to look at corrected age and grading for motor milestones. But something to consider is that if you take two babies, one that was premature without flexor tone and then one that was born term, when they get to the same age, their flexor tone won't be equal. So that's something that we consider with delays and gross motor milestones. So that's something really important to keep in mind as your baby's developing. Great. And then just quickly touching on this, proximal to distal. So one of the most important points here is that our core becomes the powerhouse for all other movements. So the more proximal the joint needs to be stronger before the distal joint. When your core is strong, then you're able to work on strengthening other things. So this is a great example of this here. So this baby is working on hip, arm, shoulder girdle, and core strength all at the same time, but we want that core to be developed, and then we put them into other positions, maybe in eventually half kneeling to standing and those types of things, once they've already had an opportunity to slowly introduce some weight into their joints, so it's a little bit safer. And then bringing up equipment again, why we want to think about it. As physios here, we typically don't recommend things like jolly jumpers because it goes against this principle. So this is always a big topic and people have lots of questions. We never tell parents how to do anything. We understand lives are super busy. There's lots going on. If you're running around doing laundry, have to go to the bathroom, cook dinner, and your child loves a jolly jumper, that's okay. We just usually recommend to limit time in things like that. Basically, when you're in a position, a jolly jumper, other pieces of equipment, your core is turned off, and then you're bouncing and strengthening and going on your legs that aren't ready to necessarily take that weight. And then we're losing opportunities to work on strengthening our arms and our core, even our head strength as well sometimes. So just something to consider, and you can always ask us at the end about equipment, but something that we typically don't recommend. Okay, this is also a big one, which we touched on bits and pieces. How does prematurity affect development? So we know we often expect, and it's not always, but developmental delays, even though we go by a corrected age when we're looking at it, we do expect, because of all the things they face when they're born early, that there will be some delays. Again, some babies may not, but it's just something that we know to expect and we don't want people to overly worry about. We know that's within normal for a premature baby. Proprioception and the womb. So again, if we're thinking about being in our little cocoon and we're in that flexion position, we get so much proprioception in the womb. We are covered and able to push and move against the walls inside our mom. And that gives us proprioceptive feedback. And that's actually where we learn to activate those muscles a little bit. So that's when the baby can first start kind of pushing and kicking back. And proprioception is just body awareness. So that's how the baby begins to slowly develop that body awareness. The earlier you come out, the less time you have to get the pushing and moving and activation of muscles. Considerations, as I mentioned, for extended stay in the NICU all apply to what I said before. So loud noises, lights, having tubes, different kinds of feeds, being held, all those things change significantly the longer that you're in the NICU. Lots of physios coming in, working on different things, but it can be quite overstimulating, and then it can change things. So as I mentioned on this next point here, maybe constant overstimulation and constant sensory information coming in, it can actually affect later when you're born, what motivates you and what makes you want to move, and you may get overstimulated easy, or you may need a lot of stimulation. So it can work either way. Flexor tone, I harp on this a lot, but it's just so you understand where the delays sometimes come from. So keeping that in mind. Intubation and breathing. So if a baby has to be intubated and have, for example, a CPAP machine or things like that, it can actually affect how the shoulder and neck muscles work. So the front of our neck can actually become a little bit weaker, and we may have more of a posture where our shoulders are up towards our ears. So we have to consider that. And then also with that, we typically will have, sorry, I'm trying to make sure you can see me. We will also have extended and retracted shoulders a little bit, which can lead to a position of more extension as opposed to flexion. So these are all things we kind of consider while we're moving through. And then postural stability. Typically, if you don't get that flexor tone automatically, you will have a weaker and less stable posture. So these are all things, and it's not limited to this, that we consider when we're talking about premature babies. And as we mentioned later, it's why it's so important to really keep a close eye and almost have that second pair of eyes on them at all times. Great.
So now I'm going to talk a little bit about how we actually track infant development. And the first thing I think we're going to talk about is chronological versus corrected age. So we've mentioned these terms quite a few times. You keep hearing corrected age, but what does that actually mean? So chronological age is the age that a baby or a child is based on their actual delivery date, versus their corrected age is the age of the child based on their expected delivery date. And essentially this means that their corrected age would be their chronological age minus the number of weeks that they were born early. And it's particularly important to consider because what this really means is that if a baby's chronological age is 5 months, so meaning if they were born 5 months ago, but if they were born 2 months premature, then really what we're expecting their motor development to be at is more along the lines of a 3-month-old who was born full term. And that's really just to account for the time that they spent developing outside of the womb. And that's really also to make sure that we're not discounting the time that they didn't get to spend in the womb. Like Lexi said, there's a lot of development. It's really important for proprioception and developing that flexor tone. So we want to give little ones a fair shot when we're assessing their development. Great. So how do we actually assess these motor milestones? It's not like you can say, hey, baby, you got to roll over there, and then they'll do it. So because of this, we use a lot of structured and unstructured playtime. And we really observe the movement in an enriched environment. So whether that means adding in toys or parent participation or various things to help with encouraging that skill demonstration, that's really what we try to do. And then the things that we're really looking for, like Lexi said, it's really important that they have that base core strength. So looking at their stability, looking at their symmetry, are they using both hands equally? And then also, if they're not achieving a certain milestone that we would expect, why aren't they achieving that? So we really look closer at that rate limiter skill that is preventing them from potentially performing a higher level skill, and really focusing on that area as well. And then we also do use a variety of standardized measures in the clinic. So 3 of the more common ones are the Alberta Infant Motor Scale, or the AIDS assessment. And I'm going to talk more about that one in the next slides. And we also use something called the Bailey Scales of Infant Development, as well as the Hammersmith Infant Neurological Examination, also known as the HINE. Awesome. So I'll talk more about the Alberta Infant Motor Scale. This is one that we will more oftenly use at the clinic. So it's valid for 0 to 18 months. But it's a really nice illustration of not only the main motor skills that we often think of, such as like rolling and crawling and walking, but it also breaks down it into smaller skills and shows those like mini milestones that little ones would need to learn before attaining those bigger skills. And it's also it's a nice kind of illustration to show parents of like, okay, they can do these things, but these are the areas that they're having a little bit more difficulty with. And it gives a nice comparison over time. As well, because it compares skills of peers to the same age, it gives us an identification and helps identify babies who might benefit from further monitoring. So with this scale, anything 10% below, anything below the 10th percentile of on this scale, we would typically refer out to the pediatrician or to the GP for closer monitoring and seeing if there's any other referrals that are needed. And the other thing I wanted to mention with this scale specifically, it's really important that we use corrected age. So this is where the distinction between chronological age and corrected age really comes into play. We always want to be using corrected age because it wouldn't necessarily be fair for us to compare a 5-month-old full-term baby to a 5-month-old preemie baby when they just haven't had the same amount of stimulation and experience. Great. So now we're going to talk a little bit more about the top to bottom motor development. And if you guys remember earlier, Lexi was talking about like the head to toe development and how that's a huge infant development principle. So we're going to go a little bit more into detail about this. But before we start, we really want to caveat this section by saying that every baby develops differently and at their own rate. Whether that is a baby that takes a little bit longer to learn skills, but they're showing continued progress, or if it's a baby that's very advanced or vice versa, it's really important to remember that as long as we're showing progression, that's the main goal. And that there's so much variation in terms of what ages are quote unquote expected for them to learn certain skills. So with this section, we're really going to focus on the principles of development and how we would expect those principles to develop further. So the first one we're going to talk about is head control. So when they're first born, there's very few movements that are happening, but that head control is really that initial building block of further skills and further strengthening down the body. So with premature babies, we really encourage check-ins at this early stage so that we can help facilitate movements at the beginning to help them set up themselves for success in the future. So at the start, it's probably going to look like momentarily lifting up your head in tummy time, and then that's going to progress to longer bursts of greater head lift. So if they're only lifting a little bit off the ground, we would expect that over time they're lifting higher and higher, achieving longer durations of tummy time before they get fatigued. They'll start to turn their head from side to side in a varied number of positions, whether that's on their tummy, on their back, being held upright. And then we also want to start to see that they get a nice chin tuck when you're getting them from on their back up into a sitting position. And again, like Lexy mentioned, it's all that flexor tone, getting that core strength, and it's learning those movement patterns that are going to be needed later on. So at this stage, things that we can do to help, a big one is toy placement, or sometimes I like to say like parrot placement. So if a baby's laying on their back, you can use toys to encourage them to look a little bit higher up in front of them or from side to side to get them more used to that movement. Trying to limit time spent on their back. Obviously, this really depends on family situation, what's needed at the time, but trying to offset the time that they spend on their back when they're sleeping with tummy time when they're awake and alert. And then varying tummy time positions. So getting them flat on the ground, or if they're using a prop, like in a photo you saw previously, or even doing a bit of a Superman hold. So what this could look like is if this is this baby holding underneath the chest and lifting them up into the air and then kind of flying them around side to side, or getting them to look up into the world a little bit more. And things that we want to consider of when we need to look into physio or when physio might be appropriate is if we're seeing a lack of progress, regardless of that diligent practice time. If we're not seeing their tummy time tolerance improve, if they have a preference to look one side or another, or if they also have some head shape concerns. So you might see a flattening on one side of the head or a flattening on the back of the head. Those are all things to consider.
Awesome. Okay, the next one is upper body control. So again, we will mention tummy time as another thing we work on through this. But where does it start? So at birth, we see more spontaneous movements. So we kind of joke, like it's like the kicking and punching phase where they make those random movements around. That's how their body starts to get stronger and those muscles kind of learn to activate. And then, as Brie mentioned, with reflexes, there's reflexes that actually help us do those movements first. So there's ones that, for example, will have us reach out and extend our arm, and they actually initiate that movement. It's just a pure reflex, but then you use that reflex to eventually be able to do the skill of reaching. And there's lots of little reflexes like that, same with walking and steps as well. So purposeful reaching and grasping is kind of the next phase. And then pushing up and extending our arms into our favorite tummy time. So you can see the baby in the picture here is now working on their arm and shoulder girdle strength since they've already mastered that head control. You can see they're playing. So how can we help with this? So again, toy selection and placement is really great. So I have a picture, so it's close, or I have one here. This is example of an O-ball. So giving reaching toys that are easy to grab. So something big, but that also has holes in it makes it a little bit easier. We also have an example here of an open chain type toy. Sorry, I put that in front of the screen. So these are easier to progress. And then once their reaching has become a little bit better, then you can have something wide that they can grab. It's really opposite. There we go. Yeah. Perfect. So that's something we can do to help. Tummy time, as Brie mentioned, in various different positions. You can do it on incline, decline. You can have tummy time still on your chest and they're pushing up on it. So there's lots of different ways you can kind of make that fun. And then putting all those things together. So then once they're in tummy time, putting things out of reach and getting them to practice reaching and pivoting and moving a little bit. So as you progress that tummy time, those are all ways you can really help the arms get stronger. And then again, when to see a physiotherapist. If you're noticing one side is preference, so maybe you see lots of reaching. One thing we always mention to parents is that a child or a baby shouldn't be right or left-handed until they become closer to school age. So once they're learning how to write, again, that can vary from 3+, but an infant and super young baby should not prefer one side to the other. So if you're noticing that, that's a reason to come check in with us. Not bringing hands to midline. So as we mentioned with missing flexor tone with premature babies, if they are missing that flexor tone, they likely will need to be taught to bring their hands to midline and need a little bit of extra practice. And then closed fist or arms constantly flexed or extended. So that would also be a reason to come check in and maybe get a little bit of a follow-up. Awesome.
And then going into trunk control. So babies really don't have that much trunk control at birth, but they start to develop it more so with tummy time. And then when they're on their back, they're going to start when they start to reach for their feet. So kind of in that, like that happy baby pose where they're reaching for their feet, playing with their feet or at their knees. From there, when they start to sit, what we would expect is that they start sitting with their hands on the floor, similar to what this little guy is doing in the photo there. So bringing themselves forward, bracing themselves on the floor, so that they're still working on their trunk control, but it's not doing all the work for them. And then over time, they'll start to be more and more comfortable bringing their hands away from the ground, being in that sitting position. Maybe they're starting to reach in and out of their base of support, getting into and out of different varied sitting positions, and then eventually getting into that 4-point hold and working on that reciprocal crawling movement. And things that we can do to help is lots of floor play. So getting them on the floor, letting them explore their movement, giving them different options of toys. So sometimes we'll put toys a little bit closer, some toys out of reach, in different directions to really encourage them to be curious and move around their environment. And then also working on those sitting transitions. So getting in and out of that sitting position is a huge area that's going to really help with that trunk control, and also that like derotation reflex or that added trunk control is going to be a huge one. And then when to see a physio. So if your baby is sitting and they continuously throw themselves back, so if they're sitting down and then they kind of arch their back and lean back and they can't catch themselves, if they have an inability to maintain a sitting position, like what I was mentioning earlier, or sometimes we get the opposite too, and we have something that we call happy sitters. So these are the little ones that they get into sitting and they will sit there all day, but then they don't really want to move out of that sitting position, or they seem super nervous about moving in and like in that sitting position. So at those times, we do also really want to focus on like getting them comfortable with moving their body, moving their legs out of those positions, so that again, they have more independence in play, they have more exploration, and they have greater affordances to learn their next skills.
Great. Okay, lower body. So this one gets a lot of questions usually. So when it comes to walking, cruising, kind of going through the phases of like progressing into crawling. So if anyone has a question, we can save it for the end, and it'll be great because we love talking about this. So where does it start? It starts with spontaneous movements like kicking. So again, as I mentioned, that punching, kicking stuff is where we kind of start. Using the legs to roll and to push. So as Bree mentioned, they start to use their reflexes to roll, and then we start to use our hips and our legs to kind of help facilitate that movement. Transitioning in and out of sitting. So the things we work on for specifically the happy sitters, but for everyone, we want them to start transitioning in and out. That's where the hips will start to get stronger, and then we use them to kick and kind of move. Then we're in that crawling and 4-point position. We have our strong core. We now get the hips and arms strong together, and then we start moving and learning a reciprocal pattern, really strengthening those hips and then getting the legs moving. From there, we work on half kneeling to standing, from standing to cruising, and then walking. So that's where we really start to work on that foot and leg strength, and that's what we kind of like save for last. So things to consider when getting into that walking position. Once you make your way there, that's when the feet will initially get stronger, but we don't expect to have really nice arches. We might see some penguin waddles. And even for the first like 6 months of walking, we expect to see babies get less wobbly, have more control, get more strength in their feet. So it is normal if they do a little bit of that. So we'll talk about kind of how to help first, and then some things that we don't consider kind of typical. So how we can help with this, again, safe play zone. So we encourage lots of big play spaces, similar to the ones we have where we work, where there's a play mat or carpet that's safe to be on. Sometimes it means a mix of things, so maybe some harder surfaces. That's where you can start. Placing things out of reach. So no matter what the toys are, whether it's what we kind of mentioned, some fun noisy toys, your faces, whatever they're motivated by, even a snack, putting it a little bit out of reach to really encourage that motivation and movement. And then having various heights. So especially when we get to the lower body portion where we're learning to pull up onto things, we're starting to cruise. If there's chairs, couches, tables that are safe, things that they can grab, different heights and things to be motivated to. It helps progress those movements. So that's a really great tip for at home that's easy to do. And then when you want to come see a physio, if you're noticing asymmetrical things, so if there's one side being used way more than the other, if you're noticing kind of a funny pattern, sometimes they're really cute, but they might actually not be correct. So bum scooting is an example of that, where they kind of sit on their bum and scoot around. You may also see it in crawling, non-symmetrical or an asymmetrical crawl, or even an army crawl that continues. You might see dragging on one side, things like that. Not being able to get into their hands and knees position, or wanting to skip crawling altogether. Maybe also not tolerating being on their knees at all. Not tolerating standing, and then consistent or persistent toe walking and standing on our tiptoes. So we do expect at first, when they're learning to stand, they'll pull up and they'll go on their toes a little bit, but as they get stronger, we would expect them to come down on their heels. So that is something that we would want to further investigate a little bit. Great. And as Bree mentioned, and I mentioned a couple times, we really want to express to you guys that there is a huge range of normal, and that it is also even an added normalcy that premature babies will be delayed. So we really harp on that, just because a lot of parents can get really worried and see some of the things that we talk about later in red flags and yellow flags. But a lot of the time with premature babies, they do have a reason for doing what they're doing. And obviously there's a huge range. So we just want to tell everyone it's okay that they might be at a different place than their peers. What we're looking for is that the motor milestones, even if they're not achieved in the intended order we just talked about, we want to see new skills being added always. And if there's issues with those in-betweens, that's kind of where physio and other people come in to help. So even if a baby is falling behind their peers or is already behind, they still might be within that normal, especially when we're looking at a premature baby. So sometimes they just need a few recommendations to be able to get to the point that we're trying to get them to. We always say practice makes progression. Sometimes a certain baby will just need a lot of practice to be able to master a skill. It doesn't mean that they won't do it. They just need more time to learn. We put some specific objective examples in here. So some of the scales that we use that Bree mentioned have a huge range themselves. So sits alone steadily, within normal is considered 5 to 9 months, which is a big gap. Walks alone or walks independently on the Bailey scale, 9 to 17 months. That means there's a normal with a huge 8 months or more difference, comparing peers that is still considered that within the normal range. And then even with these scales, or if you're looking at different scales on whether it's Google or an actual scale that we use at Physio, they're all a little bit different. So there is a huge range of normal, and there's not specifically a scale that makes sense for premature babies because there's such a big range they were at. So these are all really important things to consider if you are feeling worried. It's always great to have second eyes, but sometimes you just need a little extra practice. So we always add that in.
Great. So now we're just going to touch on a little bit more about our role as physios and how we help with progressing those motor skills. So one of the big principles that we talk about is that motor planning piece. So babies really learn how to move by trying to move. So sometimes what this means is that there's some trial and error in terms of their problem solving. So for example, often on the first attempt, they're trying to learn a specific skill. It's not necessarily going to be that refined motor pattern, but it becomes more and more successful as they continue to practice. So for example, if a baby's trying to get to a certain object and they're trying to use an army crawl pattern, at first you might see a little bit of that body wiggle, a little bit of that half rolling in a general direction. And then over time, they'll start to get that more reciprocal or coordinated arm pulling forward. They might kind of kick with both of their legs. And it's more direction specific toward their target. But the biggest thing is really babies need to learn that they can move toward things, not necessarily that things get brought to them. And I find that especially sometimes this is a harder thing to kind of wrap our minds around and really be confident in being able to take a step back and letting them kind of go through a little bit of that struggle to try to get that movement pattern on their own. So they really need to have motivators that are out of reach to inspire that movement. If they learn that things are always brought to them, then they won't necessarily need to plan to move, and their motor pattern becomes, I'm going to point to that and then it will be brought to me, versus I see that toy over there and I'm going to get to it. I'm going to move myself to that. So a lot of the strategies that we teach families are to emphasize babies being the director of their own movement, with parents or others being a supporting role in that. Great. So I kind of mentioned this earlier about those mini milestones. So babies don't just learn one day to suddenly crawl or walk. And it's our role as physios to identify where which smallest skills that the babies need to work on to achieve their motor skills. So that's really why earlier in the presentation, we were trying to break down, if we think back to like that trunk control piece or that lower body control piece, it really starts with those smaller skills that maybe don't look as, I guess, like fancy or as exciting as like the crawling skill, but they're really important to get first so that they're building the strength and the confidence and the endurance to be able to do those bigger skills later on. So for example, the crawling piece. So when babies are trying to learn how to do a hands and knees crawling pattern, they'll likely start with the commando crawl or that belly crawl. They'll start to push up onto their straight hands. They'll start pulling their knees under, and then they might rock in that hands and knees position in 4-point, and then they'll start to hop their legs forward symmetrically. So all of those little things are almost like little tick marks or little checkpoints of their pathway to learning how to crawl. And then the other considerations that we need to consider, especially more so with crawling, but in any skill, is are they able to get into and out of that sitting position or that needed position independently? And also, does their environment allow them to explore? So like we mentioned before, having a safe play space, giving them many opportunities to learn that they can move toward things. Those are kind of things that we can do to set up their environment to help with promoting that.
Great. So as you heard me briefly mention before, there's things that we call kind of red. Sometimes you'll hear red, yellow, orange, different color flags. This is just things that we want to be really careful to watch out for, especially in premature babies, as we want to really closely monitor and make sure everything is going smoothly. With premature babies, we do expect we might see some of these things, and it's considered a little bit more normal than maybe a full-term baby. So it might be less of a red flag, but it's still a reason to be monitored. So we mentioned most of these before. So if there's limited movement of arms and legs, so maybe there's not that kicking or it's only on one side. Increased muscle tone. So the tone of the muscle is just kind of the way that it feels, and it's how that muscle is activated. So if we're trying to move our baby's limbs and it feels really, really stiff, or if opposite, it feels really, really squishy, that would be a reason to monitor a little bit more closely. As we mentioned with lots of things, asymmetrical movements, whether it's legs or arms, or even if it's movement of the neck differently, regression or a continued delay. So we never want to see skills be lost or go backwards. And we also want to make sure we're always adding new skills in. Consistent use of one side of the body, so whether it's arm or leg, and then excessive extension patterns, which we mentioned. So if you're missing that flexor tone, you might have this, but this is something that you would need to work on. So that's just something to be aware of. And then if we go on, when should you be seeing a physio? So with premature babies, the earlier the better. So early intervention is key to continue to be monitored and just get through all those milestones and check up all the time. So every province is different, but BC and Ontario have a similar system with early intervention. So likely if you're premature, you get moved into an early intervention program. So how it works with us at Kids Physio is we do initial assessments to look at movement patterns. We assess those reflexes. We scan for those yellow and red flags. We progress gross motor skills, provide education on ways to support your child at home, and then provide exercises to practice, whether it's with videos, with pictures, with actual hands-on facilitation. We usually show you guys how to do those things. If you notice any red flags or have concerns, come on in. If your baby is struggling to progress through the motor milestones or get those mini motor milestones, if you need guidance at home on how to make a safe space or equipment advice or anything like that, if you want to have, just missed it. If you want to have a checkup, that happens all the time. So sometimes parents they feel like everything's going really well, but they want to check in and see things they could do at home, or if there's anything, or just to see kind of where their baby's at. That's also totally fine. And if you need help kind of creating a safe play space at home as well, as I kind of mentioned. Great. So what are some things you guys can do at home? So as we harped on a couple times, having a safe play space, it doesn't need to be anything fancy, just something where there's no risk. So if you're leaving your baby kind of unattended to explore, that they're able to do that and there's no like running over and having to stop them from like touching an outlet or a sharp edge or something like that. So that's a great way to explore. Trying exercises with little to no clothes. So we kind of call it diaper time, but essentially when you have clothes on, it can be an added layer of restriction or weight. So if you give time to just be in your diaper and play, it can actually help with some of those restrictions and let you progress a little bit more. Place toys and motivators outside of reach, as me and Brie mentioned, for each stage. That's a really good one to do at home. Limit use of equipment when possible. So again, each family's needs will be different. We're not saying don't use it, but we're saying trying to find alternatives or having that safe play space so that they can spend time in lots of different positions. And that was my next point. So changing up positions as much as possible. So babies are going to spend a little bit of time on their back. They're going to spend time on their tummy, their sides, and then the more skills they get, then they can be in sitting and move out of sitting. An example of different types of sitting too, side sitting, crisscross, or long sitting. And then a great one too is creating different levels so that, again, when I mentioned with legs, when they're pulling to standing and being motivated in different ways, that they can have those different levels to encourage them to get up higher. So those are just some things you can do at home. So a quick summary, because we covered a lot of information and we're kind of going. Kids Physio, which we will talk about in a second, is a private pediatric clinic for physiotherapy for babies and teens for a wide variety of reasons. Developmental milestones have a huge range of normal, and Physio can help with each step of those. There's many ways that being premature can affect your development, so it's good to be aware of them all. Premature babies benefit hugely from being followed by a physiotherapist. And then we do a lot of the intervention and kind of follow up and monitoring, but we also mentioned here what the red flags and kind of yellow flags are. Great. So quickly, we're going to touch on what Kids Physio is, because everyone's probably wondering, where do you work? So it does not look like an adult clinic at all. So it's a really fun space. So if you've ever been to a Kids Physio, awesome. We're all across Canada. We work at Cambie specifically. So this is kind of what they all look like, but the spaces will be different. So we have a lot of greens, a lot of blues, and a lot of fun toys and places. So you can kind of see when you're looking, there's safe play mat and spaces, each different spot around the room. So there's options for privacy. This was one of the first 5 clinics, but they've been around for a long time. This one specifically opened in February 2019. And now we have over 14 locations across Canada. So if anyone's from Ontario, there's a few locations there, and we're kind of spreading all over. Great. And then quickly, if you want to read our mission there.
So really, our mission is to provide the care needed for all kids to reach their absolute maximum potential and 100% recover from injury. And I think a big thing, the reason that Kids Physio was founded was birthed out of a need for private physiotherapy care. And we hear it oftentimes that families will come in and they say, like, I'm so grateful that we found you. This is what we needed. And having that, just like knowing that you have a support system around you to help answer questions or provide guidance is a huge relief to a lot of the families that we see, regardless of why they come in. But now we'll kind of open up the floor for questions.
Perfect. I also saw, Peita, I saw a couple of questions from you. So your first question was, can Physio help with early feeding challenges and oral aversion? So actually,
sorry, Lexi, I'm just introduce Jenna, because we are going to monitor the questions and the comments. Thank you so much for your presentation. That was great. There's a lot of information and parents to digest, but thank you so much for that. I just want to bring Jenna here. So Jenna is also a Preemie parent and journalist, and she's in New Brunswick joining us here for the Q&A. Yes, we're going to. So Jenna, you can say hi because your first
Hello.
time.
Yes. It's nice to actually be on the chats. Thank you.
Yeah, so we are going to, there are a few questions on the chat, and I'm going to start with Petia. Petia, thank you so much for joining us here today. I know her daughter is with some feeding issues, and she asked a question, can Physio help with early feeding challenges and oral aversion due to structure function issue like a low functioning tongue movement or a tongue tie? She had asked, she had added Just to clarify, solid food feeding challenges.
Yeah, so I'll address that question. So absolutely. A lot of the time with a preemie, because of the, like Alexa was saying, if you're spending a lot of time in that, in the NICU or otherwise, if you have any other like tube feeds or anything like that, that definitely affects how not only that you position your neck, but also it leads to muscle imbalances in the neck. So a lot of the time babies, if they have like oral aversions, we do a lot of desensitization. We can do an internal mouth exam. So that's with the gloved hand. We take a look at what muscles in their jaw might be tight, their neck might be tight. We look at their tongue movements, and we have a lot of success with not only desensitization exercises to help with an oral aversion, but also strengthening movements of the tongue and of the cheek to make sure that they're using their suck-swallow reflex appropriately. So a lot of the time babies, they have a little bit of time at the beginning. They kind of are trying to figure out how to properly latch and those kind of things. Sometimes it does come down to positioning. Sometimes it does come down to certain muscle groups are being overactive and other groups aren't working as hard as they need to be. So part of the role that we play in infant feeding is really to look at where those difficulties are coming and then giving recommendations and strategies to help with overcoming those issues. But for sure, like physiotherapy, and I think especially with those newborn feeding issues, it's a newer area that's kind of like coming into light. And we do a lot of like collaboration work with GPs, pediatricians, and lactation consultants and SLPs, OTs to really figure out what all the pieces of the puzzle are that we need to put together and really help the kiddo.
Sorry.
Oh, no, I was just going to say it is a specialized course that Bree has taken and some other physios at our location. But if you're trying to find someone with the kids physio, just checking with the front desk or admin team so that you can find out. But there is a course for physios to learn a lot, as you can tell from Bree talking about it.
As a physiotherapist, what is the difference between your work on feeding and the OT works? Because to be honest with you, I didn't know physiotherapists would help with feeding. For me, all our feeding issues were with OT that we dealt with.
Yeah, totally. I think there's definitely quite a bit of overlap in terms of the OT world and the physio world. And really what I always like to explain to families and parents is it doesn't really matter if an OT is doing your feeding stuff or if physio is doing your feeding stuff. The main thing is that if you have a concern that someone is looking at it and helping you. Some families really connect with OTs and some families really connect with the PT philosophies. Regardless, as long as you're getting the progress and the support that you need, that's really the important piece. From a physio perspective, really when we go through a feeding infant assessment, we do spend time like looking at the jaw and the jaw movements and the neck movements and all that. But oftentimes if there's a feeding concern, we also want to look further down the chain, so farther down the body. Sometimes if there's a pattern of tension on one side of the body that trickles up into the neck, or if there's any type of asymmetry, or if they have difficulties with tummy time, or if they have reflux issues, all of those things, we spend also an equal amount of time on that body work piece. So addressing issues that are farther down the line that can be also affecting their ability to freely move their head or their neck or what have you. So I guess my my answer would be that OT and physio are quite similar, but potentially the way that we approach addressing an issue or looking at an issue might vary a little bit.
Okay, thank you. Jenna, you have any question? I think we have time for one more question.
Actually, there was one point that you brought up that was kind of new to me to hear, because a lot of it was review from when mine were little. But you talked about sensory issues, and I'm curious to hear a little bit more about what you see in infants and toddlers and what parents could be looking for that, you know, we might not otherwise think of as being sensory issues that are left over from NICU time.
Yeah. So this again is like there's such a huge range of what this might look like. So to summarize into smaller categories, but there's a lot of variations between this. Sometimes you will see sensory seeking or sensory avoidant. and different signs of what overstimulated is. So your baby might just get upset a lot all the time, and then you kind of relate to like, oh, they don't like loud noises. It could be something the opposite, like they do better when there's lots going on around them and there's lots of loud noises. Bright lights, same thing. Sometimes a baby will catch its attention from looking at a bright light or a window. There could be same thing with musical toys versus no musical toys. There could be a constant need to be touching something. So even in the way you're handling your baby, if you are grabbing to help roll or to sit and they kind of fall into a certain pattern versus going against it, they could be even sensitive and need desensitization the same way Bree was talking about in the mouth, throughout their body and their hands and arms. They might always want to be grabbing things, or they might not want to touch something at all. And it actually can affect their motivation for toys as well. And they might have to slowly be integrated to different types of toys. And that actually can stem, sometimes we joke that babies are like, you have all these awesome toys, and then they're interested in like a cardboard box. And that happens often, but sometimes that can also be related to a sensory issue. And sometimes it's just everyone's a little bit different. I would say the more you go through the milestones, things you might notice in standing or even on your knees. So things when you start to learn to weight bear, avoidance. So yes, sometimes there can be some kind of injury or pain that's making them avoid that, but often it can be sensory related. So if you're seeing kids up on their tiptoes all the time and avoiding that heel contact, that can be sensory. Same thing with crawling, avoiding crawling and maybe dragging. You're getting constant feedback through your body, but you're also avoiding weight bearing through your knees, which gives a different type of feedback. So those are all things you might see as the baby kind of progresses through motor milestones. There could be some avoidant patterns that it seems, or even just overstimulation, constantly upset for different reasons that you can't really figure out. But again, a huge range. So if there was like anything specific, you can totally ask, but there's a lot of time we work on sensory integration or even desensitization in certain cases.
That is so great. Okay, so I just also want to remind families who are going to neonatal follow-up clinics when the baby are born extremely preterm. They have a multidisciplinary team there to assess the babies and make referrals to OTs, PTs, and speech-language pathologists in the community. So just families know how important it is to have those neonatal follow-ups as well, because they also do the assessments and refer to community. But Brianna and Lexy, thank you so much for joining us here today. It was, oh my, I learned so much from you. And we had some comments of people gonna watch again because, you know, you have to digest piece by piece and really focus on one at a time. But it was great and overall information for all families who had babies in NICU. And Jenna, thank you so much for joining me here today. We'll be back, and Jenna will be hosting our World Prematurity Day live session on November 17th. So stay tuned, and thank you.
Awesome. Thank you so much.
And to all of you watching us live today, thank you so much for joining our live session. And the video of today's session and all our other videos are available on our website, which is right here, the Canadian Preemies.org. And I want to thank our sponsor, AstraZeneca, for their ongoing support of our education sessions. And we are a charitable organization, and we believe that through support and education, we can empower families, ensuring they are ready to care for their baby. Please visit our website, consider making a donation. Together, we can create a brighter future for all our families. And I see you again next Friday, 1 p.m. Eastern Time. Stay well.